One of the main misconceptions that people have about spine surgery is that you may come out of it with chronic back pain. I really want my patients to know, I want to emphasize that that's not the case. Here, we really focus and emphasize on indications. It depends on what condition you have, and we can treat it with surgery or without surgery. And if you do need surgery, we do our best to make sure that that surgery is right for what you have so that you can come out of it. The opposite of what the misconception is. You come out of it healed and ready to live your life again. I really enjoy getting to know my patients as people, and that really helps me to be able to come up with a treatment plan with the patient as well, because the patient is the biggest part of their own treatment, and I am there to guide them through what I may think is best for their treatment. But we work together as a team, and it's as if I have a teammate every single time I see a patient. So I want to make sure that patients truly understand their condition and also understand and realize what type of treatment options are available. And I always emphasize to patients that they can call my office 24/7 and I'll always get back to them, myself or one of my staff members. And so I want to make patients feel as though there's always someone there to answer any of their questions and make them feel comfortable. I play soccer, and I played my whole life. I played in college at the University of Michigan, and I currently play on the United States medical soccer team, which is actually a soccer team comprised of physicians that represent the United States. And so my brother's on the team as well. He's an anesthesiologist, so we get to play again, and we travel throughout the world playing against other teams. I grew up in Michigan, so I'm a big fan of Detroit sports, Michigan sports. And then being out here in Colorado, I really enjoy everything that Colorado has to offer outdoors. The thing that really inspired me to specialize in spine surgery is that the spine really controls almost every mechanical bodily function. And so patients who have issues with their spine really are struggling in their everyday life to function. They usually have either acute or chronic pain, and it really not only affects their lives, but it affects the lives of their family and their loved ones. And so, patients with spine issues truly do need a thorough workup, and there are multiple different ways to treat spine patients, and a lot of them don't need surgery. And that's one of the things that really inspired me to go into spine, is that although one of my favorite things to do is operate and do surgery to help people, a lot of those spine pathologies can be treated without surgery, and usually patients truly benefit from jumping through some of those hoops prior to even considering surgery.